My name is Victoria Williams, and I am a clinical assistant professor at the College of Pharmacy. And within that role, I spend about half of my time as a hospital pharmacist. Hospital pharmacy refers to the medication dispensing and distribution of all of the different treatments that we provide to patients while they are acutely sick. Hospital pharmacy can include a variety of different positions. Some of those are going to vary hospital to hospital. In general, I like to think of hospital pharmacy as being divided into sort of two areas. One of those areas is very medication focused, and pharmacists that work in that space tend to be within the walls of the pharmacy itself and are primarily tasked with verifying medication orders, preparing medications, whether that means compounding them in a sterile space for medications we give by IV, or dispensing tablets just like you would see at your community pharmacy. And then they're also responsible for working with our technicians to distribute medications throughout the entire hospital. My area of specialization is intensive care, so you can find me in a medical intensive care unit, but we also have pharmacists that specialize in cardiology that round with our different cardiology teams, or pharmacists that specialize in infections, and you can find them alongside our infectious disease physicians. I get to see the impact of my work as a pharmacist every single day. There are some cases where I will make a recommendation on rounds, and within the hour, I can go back to the patient's bedside, look at their vital sign monitor, and make an assessment for if my intervention worked or didn't work. So I love that real-time, sort of immediate feedback around if what we're doing is making a difference. As a hospital pharmacist, some of the things I really like about my position are that degree of structure, but still unpredictability. So I know what to expect within a given shift, but then anything can happen. So I feel like I'm constantly learning something new. So it really is that close collaboration with the rest of the care team that I think is one of the more exciting parts of this job. What I really value in the hospital space is being able to join as a team member on multidisciplinary rounds and get to engage in that live conversation. And depending on how complex the patient case is or how complicated our decision making is on their drug and therapy plan, we may end up in some really healthy academic debate. And what I love most is that collaboration and just that professional capacity to work together, learn from each other, and have that really close collegial sort of relationship. For a position like this, you're really looking at some undergraduate coursework, Doctor of Pharmacy degree, and then some postgraduate training after that. If you're interested in hospital pharmacy, first I would recommend taking a look at your institution's course catalog, and if there are any introduction to pharmacy courses or career exploration and pharmacy options for you, definitely register for that. For me, I got interested in hospital pharmacy from a shadowing experience and from taking an introduction to pharmacy class. I went to Ohio State for both undergrad and my Doctor of Pharmacy degrees, and both of those programs prepared me exceptionally well for the career that I'm in today.